May is National Brain Cancer Awareness Month, and here to tell us how Austin's CyberKnife treats this particular kind of cancer is radiation oncologist Dr. Stephen Brown. Doctor, thanks for coming today.
Thank you for inviting me.
I guess first of all, could you explain what types of brain cancer there are?
There are two types of brain tumors. There's a benign, which is non-cancerous, and then there's a malignant. Malignant cancers can be from the cells of the brain, and it's called a primary brain tumor, or they can come from other parts of the body and spread to the brain, and we use the term metastatic.
Okay, and then tell me what CyberKnife is for our guests who might not know.
CyberKnife is a non-invasive form of alternative treatment for treating brain diseases. So it's a radiation treatment system that's mounted on a robot, and it allows us to track and deliver high doses of radiation and ablate tumor or cancer cells very precisely in the brain. And it can be done in anywhere from 5 or less treatments, outpatient visits, and non-invasive, does not require anesthesia, and has minimal side effects or toxicities.
Does the time and treatment vary depending on the kind of tumor, as you explain those to us?
Yes, it does. If we have a brain tumor that's near a functional or very eloquent area of the brain, we may break that treatment up into several treatments, say 3 or 5 treatments, in order to reduce any potential toxicity to the critical structures. If it's in a non-functional area, we can typically have the treatment done in 1 treatment.
Are these kinds of tumors, do they start in the brain? Does the cancer start somewhere else and spread to the brain? How does it work in getting there?
Well, frankly, most brain tumors spread from other sites of the body to the brain. We use the term metastasis or metastatic disease. But primary brain tumors originate from the tissue of your brain. And there are, again, like I said, they're named from the cells of origin. Most brain tumors are something called gliomas. Glial cells is what consists as the matter of your brain. And so there's very malignant tumors like glioblastoma multiforme, that's a mouthful, GBM, which is the most aggressive brain tumor. Then there's lower grade gliomas. There are functional disorders that we treat as well with the CyberKnife, and they're, let's say, arterial venous malformations, which have to do with the blood flow. Now, it isn't a brain tumor per se, but it's a inadequate blood flow to parts of the brain, and we can ablate those with CyberKnife. There's also a functional disorder of the trigeminal nerve called trigeminal neuralgia, which causes facial pain. And we have the capability of treating that in a non-invasive approach.
This might be a really dumb question, but how would someone even know they might have a tumor? I mean,
you bet.
Are there signs and symptoms?
There are, and I'd say some of the classic signs and symptoms for a brain tumor would be dizziness, disorientation, headaches, nausea, visual changes. Kind of sounds like me in the morning before I have a cup of coffee. So
not to alarm anyone, but there are things you can look for if they keep on recurring.
Facial paralysis, difficulty with communication, or just some of the things that come across as abnormal for a person that they'd probably want to investigate.
Well, you obviously had your coffee today, so we're all happy for that. Thanks for explaining it to us.
Thank you so much.
Austin CyberKnife is located on I-35 at the University Medical Center, Breckenridge. Call them at 512-324-8060 or go to austincyberknife.com.